the frontal horns will be dilated, even the temporal horns will be dilated, and the posterior fornix will be depressed. But on taking a radiologist consultation, these features were not present on his MRI.
Okay. Doc, is it possible to show my screen if it's okay?
Yes, sir. Your screen, sir.
Yeah, if you can. I'm sorry, this is complex. I wish I could have been there.
No, sir. It's an honor to have you.
Are you able to see my screen?
Yes, sir. We are able to see your slide.
Yeah, it's not a slide. This is also a Word document. So I'm going to give this to you guys after this is over. This is our cognitive books that we carry when we do examination. So if you look at this, if you look at it, then at the end of an examination of a dementia patient, especially when we do a cognitive assessment, we try and localize these to some areas. See, neurology means localization. You cannot get away with localization, without localization. It's not like, randomly putting it at some place. We have to put it at specific places in the brain so that we understand what pattern of disease that is there. So for example, if you look at the frontal lobe in this patient, so you were saying something like there was a perseveration, maybe there was difficulty in initiating some arm movement, and then did you look for all that? I don't know. There was ideomotor ideational apraxia that you mentioned, and then you mentioned about some weakness in the hand, maybe agraphia, aphasia, all that. So there is definitely a frontal lobe involvement in this patient. Then we came to the parietal lobe, if you can come down. So there you can say that we were talking about attentional disorders. He was not very attentive. And then you had a right-left disorientation. He had a agraphia, acalculia. Correct me if I'm wrong. Meaning all this was there, right? He had a constructional apraxia, all that. So there is a parietal lobe involvement. There is a frontal lobe involvement. And then you talked about temporal. See, what was the most important thing about Alzheimer's is the memory that I wanted to know. How was the memory?
His memory, his MMSE was 6/30, sir.
That is a mini mental status examination. So whenever we are looking at dementia, the first thing that they used to talk about dementia or Alzheimer's was memory impairments. That was something that they came, and then they went away from it. That is why when DSM came into the diagnosis, now we are talking about lobar function. Because when we go into a DSM-4 criteria for diagnosing a patient with dementia, it is based on these lobar functions. Whether in the following slides you will know. So for example, in this temporal lobe, I wanted to know, was there anything that could tell that there was a temporal lobe involvement? Did you think of any aphasia that you could see of, or amnesia for verbal information or visuospatial information? Did you have that?
Actually, sir, the only thing to think about temporal lobe was the speech, sir. The speech that he was having difficulty in naming his son and wife. So we thought of nominal aphasia.
Okay, so you were putting that into a temporal lobe.
Yes, sir.
And then you had occipital lobe. Okay, so now why I am saying that is, so there's a predominant frontal lobe involvement, probably some amount of parietal lobe involvement, but and a little bit of temporal in terms of aphasia. And then the next question that comes is whether there was a subcortical involvement or not. So it is very important that you look at these patterns. When you recognize these patterns, then we probably reach a point where we can make a very healthy approach towards the diagnosis. Because when you have a dementia, the differential diagnoses are a lot. Like supposing if you are going to ask for a PET scan for a patient, who would probably benefit from, say, I don't know, a syphilitic workup. You are actually narrowing his finances towards a diagnosis which you do not know. It's like a shotgun therapy, You try everything and then see which one works. So your diagnosis in this case also becomes much difficult. If cognitive neurology is a difficult subject, but you have to recognize some pattern. If I'm able to impress that on you, that would be good. So to me, it looks like a frontal lobe involvement, okay, parietal plus temporal, but a lot of subcortical also. And I would also look at pseudo-dementia, sorry, not pseudo-dementia, pseudo-bulbar also involvement in it, and a rapidly progressive dementia. Alzheimer's will not be high on my cards. It's a good diagnosis to have, but that will not be high on my cards because it just progressed too rapidly in a young individual and with a lot of subcortical involvement. And to me, that was something that was not fitting in. But you could be right, you could have a variant of Alzheimer's that is coming in, and we don't have access to bigger images and a PET CT and all that to make that. But to me, when you look at it from a holistic point of view, this is what I would do. So if I was to approach this case, I would start off with a dementia versus a pseudo-dementia, and then if it is a rapidly progressive dementia or not. If it is rapidly progressive, which are the lobes that are involved? Is it cortical or subcortical or both? And then I'm sure you're going to show your slides where you're going to discuss this. But this is how I would have approached this case.
Okay, sir. Thank you for
you can, no, I know. I mean, it's just too overwhelming. But dementia is like that. You have to go into individual lobar functions to pick this up. I know that Alzheimer's is a possible diagnosis in this patient. I'm not saying no, but this is what I would have done. As a clinical physician, when you're sitting in your OPD or an IP, if you're giving an Alzheimer's for a 58-year-old, it comes crashing to the family. It might be the right diagnosis, but I would probably look into some other differentials as before moving into Alzheimer's.
Okay, sir.
You can show your presentation now.
Yes, sir. Actually, I have slides how we differentiated, how we come to this diagnosis.
Yeah, please share your why you did that. I mean, you should have your approach, and I'm sure you have that. Please share.